This is where we get to the Albert Schweitzer Hospital. And I end up, they give me a tour, and they give me a small room. So now I'm in a small room, and the first few patients that come in are really just people who work in the hospital. And it's not a busy day. We see patients every, 5 minutes. So we see maybe 20, 30 patients at the end of the day. But those patients, they come in, they have chronic pain, they need chiropractic care, they've never seen it before. And of course, we're doing chiropractic services on a little adjustable table, I just popped open. I had a portable laser therapy as well. So we had some basic tools. Well, apparently the word started to get out because they started to tell the doctors and the other staff members that their pains were getting better from that one visit. Next day I get in, there's people already waiting at the door, right? And we're busy, we're seeing maybe 40 patients, 50 patients easy for the day, basically busy the whole day, from 8 o'clock to 5 o'clock. But now it's also patients too, not just people who work there, it's their patients. And the average patient, they have 0 to 10 scale, an 8 out of 10 pain. They've had the pain for 8 or more years. Pain is either frequent or constant. So, and all different pains, but basically these are not people that don't have pain. They're really long-term chronic pain patients. But it was really a very interesting thing, and I didn't have to do any computer work or anything, just a blank piece of paper, and all I did is just write down what they had and their name, and just kind of try to solve their problem. By the next day, there was a line waiting for us at this point, so it's kind of getting out of control. And we had to start cutting people off of how many people we could even see, because how many people can you see in a day? Now I was staying at the Mellon House. The Mellon House was actually the founder of the Albert Schweitzer Hospital, and a woman who was cooking us dinner. I can tell you 2 stories of. We had so many patients and so many stories that I wouldn't know where to start. But there were 2 stories that stick in my mind. So I'll give you the first story was when I was back in the Mellon House. A woman that was our cook was cooking a meal. Told me that she had severe headaches every day her whole life. Took medicine just to calm it down. And then she heard that I was going to come, and so she went to her doctor and said, "There's a chiropractor coming. Should I go see him?" And her doctor said that, "No, the chiropractor won't be able to help your headache. Not your kind of headache, so don't waste your time." So we kind of talked her into it. Said, "Why don't you come tomorrow anyway? We'll take a look." She did come in the next day, and she was one of the many patients that went through. I gave her neck adjustments. It was actually a very easy problem to solve, I thought. Just she had some misalignments in the neck. It was actually too easy. Just did a couple of adjustments, and we saw her the next day when she was cooking us dinner and said that the headache was gone. She couldn't believe it. She hadn't, first time in her whole life that she didn't have headaches. Then she wasn't cleaning the house or cooking the house the next 2 days, so I didn't see her again. But Katie, who was the receptionist, she used to live there and she knows the area well. She went back 10 months later and happened to bump into the same woman, said she hadn't had a headache for 10 months. So since that day, it ended her headaches. So,